Assalamualaikum dan selamat sejahtera. Selamat petang. Saya Dr. Siti Nur Adiani Ismail, Pegawai Perubatan di Unit Kawalan Infeksi Hospital Sultanah Aminah, Johor Bahru. Hari ini saya akan berkongsi tentang MPSG Goal 1, Infection Prevention Control. Lebih kepada Infection Control Precautions in Patient Care. Okey, tak apa membuang masa, kita teruskan dengan presentation ya. Okey, konten untuk hari ini, saya akan go through basic of infection control, challenges in government hospital, definition of healthcare associated infection, SCAI, the transmission routes of SCAI, hand hygiene, infection control precautions, and also case discussion. And then later on, a little bit about needle stick injury. Okay. So what is infection? Infection is invasion of pathogens or microorganisms that are capable of producing disease into the body. It means that this pathogen or microorganism are capable to make us sick or unwell. Okay, when we think about infection, we have to think about the chain of infection. How the infection is happen. So, infection can be passed as long as the links of the chain are joined together. It must be have a infectious agent, resident, portal of exit, mode of transmission, entry of portal, and also susceptible host. So we have to think of each part of the process as a separate link in the chain so that we can prevent or reduce the rate of infection. So this is our job, to break the chain of infection as a healthcare worker where we treat our patient. Okay, what is the infection control practice? The aim is to prevent the spread of microorganisms that could cause disease in a person, and also to protect clients and healthcare providers from disease by reducing and or eliminating source of infection. So we want to protect our patient, but at the same time we also want to protect ourselves. So what is the challenges in government hospital, especially in KKM hospital and also in a big hospital like HSAJB? The main challenges is overcrowded wards. Of course, in HSAJB, kita tengok memang patient memang penuh. Sampai ke cubicle, sampai ke tengah, sampai ke tepi-tepi tanah pun ada, medical surgical ward pun memang overcrowded. Memang tak pernah ward kita ni kosong, tak ada patient. So, ini menyebabkan shortage of manpower, shortage of equipment, and also the main challenges is our healthcare worker not follow standard precautions, breach in infection control practice, not practice wash hand, not practice wear gloves, didn't wear mask or wear gown. Okay, saya teruskan dah ya. Okay, apakah cabaran-cabaran atau challenges in government hospital dalam menangani infection? First is overcrowded wards with the patient. Memang hospital kat Malaysia memang tak penuh. Especially hospital-hospital yang pusat lah seperti HSA, HSI. Memang overcrowded with the patient. Sampai ke cubicle, sampai ke tengah-tengah ward apa semua. So, ini menyebabkan juga shortage of manpower. And also of course lah, bila overcrowded wards ni patient ramai, there will be challenge, shortage of medical equipment, and also masalah yang paling utama adalah our healthcare worker do not follow standard precaution for infection control, breach in infection control practice. They don't wash hands, they don't wear gloves, not wear mask, not wear gown when attend the patient. This can cause spread of infection. So what is healthcare associated infection? Healthcare associated infection is infection that acquired in a hospital by a patient who was admitted for a reason other than that infection. It also includes infections that are acquired in the hospital but appear only after discharge, as well as occupational infections among healthcare staff. So what is the prevalence of SAI in Malaysia? Out of 70,000 plus patients surveyed in November 2018, about 800 SAI cases were detected. The prevalence of SAI in 2018 was 4.7%. This is translated to 5 patients acquired SAI in every 100 hospitalized patients. Whereas the hospital-acquired pneumonia is still the most common SAI since 2009, followed by bloodstream infection and surgical site infection. For HSA-JB, point prevalence survey that have been done in December 2021, the point prevalence survey was increased from 3.9 in 2019 to 4.7% in 2021. Okay, what is the impact? What are the impact of SAI to us and also to patients? It can cause prolonged hospital stay for the patient, can cause long-term disability, can increase the resistance of microorganisms to antimicrobials. We can see that case of CRE, MDROs increasing right now. It can cause massive additional cost for health system, can cause high cost for patients and their family, and also can increase the morbidity and mortality of the patient. Despite patient, for example, just admitted for elective surgery, but because he got SAI in the hospital, he has to be treated for SAI. For example, blood have MRSA after operation, so can cause increase in morbidity or mortality in this patient. Okay, what is the transmission routes of SAI? First is by direct contact transmission, by our hands. If we not practice hand hygiene, proper hand hygiene, we can cause this SAI transmission by direct contact, by our hands. Second is by the indirect contact transmission from our equipment. Equipment is not clean, it's not sterile. This also can lead to SAI transmission. SAI also can be transmitted through droplet transmission, airborne transmission, and also percutaneous exposure from our IV line, from our CVF, from our catheter. So we have to practice infection control practice, standard precaution, so that we can reduce the rate of infection control, and it's possible to prevent it to happen. Okay, so our goal is to have zero infection transmission. This is a role in infection prevention is in our hands. Okay, we proceed with hand hygiene. This is the best way to prevent infection transmission. Hand hygiene is the most basic and important step to prevent spread of infection. It's the one of the most effective methods to prevent transmission of pathogens. There are two ways to practice hand hygiene, either by hand wash or hand rub. Hand wash, we use soap and water, whereas hand rub, we use alcohol sanitizer. Okay, what are the 5 moments of hand hygiene? 2B, 3A. Okay, you have to do hand hygiene when, first, before touching a patient. Second, before clean or do aseptic procedure. After body fluid or exposure risk. After touching of a patient, and also after touching patient surroundings. So basically, when you attend the patient to B3As, you have to do hand hygiene, whether by hand rub or hand wash. Okay, if you wear gloves and do hand hygiene, of course, it will be ultimately clean hands. But if you wear gloves without hand hygiene, the glove that you wear still contaminated, then you can still transmit the infection to the patient. Okay, what the rules before hand hygiene? For hand wash or hand rub, first we have to remove all the accessories. So, how to hand rub? There are 6 steps for hand rub and also hand wash. Okay, it takes about only 20 to 30 seconds for you to do the hand rubs for hand hygiene. You only wash hands only when visibly soiled. I think this 6 steps, all of us as healthcare worker have to know how to do it. Okay, no exceptional because we have to do hand rub or hand wash before attend our patient. That's the compulsory. Okay, first, you have to dip all fingers of right hand into left palm, fill with hand rub solution, and pour hand rub solution over the right palm and dip all fingers of left hand into hand rub solution. So the amount of hand rub that you use, it depends of how much your palm can it covered how much the hand rub can cover your palm. Okay. The second is you must rub hand palm to palm vigorously. Kena kuat. And then step 3, you have to right palm over left dorsum with interlaced fingers and vice versa. Step 4, palm to palm with fingers interlaced. Step 5, backs of fingers to opposite palms with finger interlock and vice versa. And lastly, you have to rotational rubbing of left thumb claps in right palm and vice versa. Okay. For hand wash, the first step, the difference is first step is goes to last step, 6th step. You can see hand rub. The first step. Okay, in hand wash, first step become 6th step. Okay. It take about 40 to 60 seconds for hand wash. You wash hand only when visibly soiled. Otherwise, use hand rub because it's faster. Okay. Okay. For hand hygiene audit, we've done it every month, and we use this observation form. For UKI team, we will observe how the healthcare worker, including houseman, MO, specialist, staff nurse, PPK, all healthcare worker that handle the patient, how they do the step of hand hygiene, hand wash or hand rub. Follow the 5 moments hand hygiene and also 6 steps of hand wash and hand rub. Okay, we go next to the standard precaution. What is standard precaution? Standard precautions are a set of infection control practices used to prevent transmission of disease that can be acquired by contact with blood, body fluids, non-intact skin, including rashes and mucous membrane. It is the minimum infection prevention practices that should be used in the care of all patients and all the time. The elements of extended precaution are hand hygiene, like I explained before, is the must. When you handle the patient, you must practice hand hygiene. The second one is barrier precaution, PPE. Next, injection safety and sharps management, respiratory hygiene and cough ethic, linen management, waste management, spillage management, disinfection and sterilization, and also environmental hygiene. Okay, what is transmission-based precaution? These precautions are to be implemented in conjunction with standard precaution. When we treat patients who are known or suspected of being infected or colonized with infectious agent, we must apply transmission-based precaution according to the clinical syndrome and the likely etiology agents and then modified based on test result. There are three types of transmission-based precaution. Contact precaution, there are three types: contact, droplet, and airborne, but may be combined for disease that have multiple routes of transmission. Okay, this is tagging for isolation precaution. Airborne blue, contact pink, droplet precaution green. Okay. Okay, contact precaution, examples of disease or microorganism that we must apply contact precaution are herpes simplex, varicella zoster, multi-drug resistant organism MDRO such as Mrsa, ESBL, CRE, streptococcal disease, skin wound burns, and typhoid salmonella typhi. Okay, what are the contact precautions that we must apply when we deal with this kind of patient? First, we have to isolate the patient in a single room. If single room is not available, cohort the patient at a designated area, same with patient with the same organism. So, for example, in our hospital, HSAJB, we have only few isolated rooms. So, we have no choice but to cohort our patient in a behind cubicle and must apply strict hand hygiene before entering and upon exiting the patient room or area. So this kind of patient we have to needs to be tagged for easy identification, like I showed there before. Tag at the medical records or bedside area, and we have to wear appropriate PPE, and also we must use dedicated medical equipment. Do not share with the other patient. Okay, for droplet transmission, it caused by pathogens carried and spread by inhalable particles more than 5 micrometer in diameter. Activities that lead to transmission including talking, breathing, coughing, or sneezing. The risk of droplet transmission is high within 3 feet, 1 meter distance from the source. The example of organism or disease that transmitted through the droplet and we must apply droplet precaution are diphtheria, epiglottitis, meningitis, SARS, mumps, influenza, MERS-CoV, adenovirus pneumonia, conjunctivitis, pertussis, and rhinovirus. Okay, for this patient, we must place patient at least 1 meter or 3 feet away from the others. We must apply three-ply surgical mask for patient. Must place visual alerts at the entrance to healthcare facilities, instructing person with respiratory symptoms to practice respiratory hygiene or cough ethic, and also must consider making hand hygiene resources, tissues, and masks available in common areas and areas used for the evaluation of patient with respiratory illness. For aerosol generating procedure, aerosol generating procedure like, for example, nebulization, intubation, will increase the potential for dissemination of small particle aerosol and should only be performed when absolutely essential. Must wear a 95 respirator with the fewest number of personnel necessary and in the isolation room with negative pressure facilities. Okay, what is airborne transmission? It caused by pathogens carried and spread by inhalable particles with size less than 5 micrometer in diameter. Infectious particles will remain suspended in the air for at least 30 minutes. Okay, example of organism that transmitted by airborne varicella zoster, or disease, varicella zoster, measles, mycobacterium tuberculosis, and novel infectious disease. Okay. Personal protective equipment, PPE, required for managing patients with airborne infection. We must wear full and complete PPE for staff with direct contact with patients, which are N95, goggles, disposable gown, full face shield, and latex glove. This one is the PPE that we have to wear when we deal with patient SARI or COVID for activity C. It means that when we get exposed to the patient and we have to examine patient for SARI or COVID, we wear this PPE. Okay. For negative pressure room, negative air pressure must be maintained and monitored at all times. The room air need to undergo at least 6 to 12 exchanges per hour and not to be recirculated. The door to NP room must remain tightly closed at all times. Air need to be exhausted directly to the outside, away from the common pathway. In HSJB, we have only 5 negative pressure room. In ICU, NICU, ED, only 5. That's why we have to cohort isolate patient in isolation room. Okay, what about the transportation of patient who require isolation precaution? So we must, whenever possible, restrict the movement of the patient. If patient have to need for movement to other department, like to do X-ray, MRI, or CT brain, or to do hemodialysis, we must inform the receiving unit or department of patient's isolation status prior to transfer or movement. So the healthcare worker must wear barrier precaution, and it should be maintained at all times, both by healthcare worker and also patient. Okay, it's possible we must do the procedure for this patient at last. It should be scheduled at last if feasible. Okay. After that, terminal decontamination of equipment in contact with patient and environment must be performed after the procedure. Okay. Discussion. Okay. We go to case discussion, but this one we need two-way communication.
Apa teruskan, Cik?
Okay, case discussion 1. Puan Kamala, 40 years old lady with diabetes mellitus and end-stage renal disease on regular hemodialysis. She presented with 4 days history of fever. There was an ulcer at her right dorsum of foot which was foul-smelling. Surgical debridement was done. Tissue culture and blood culture grew Mrsa. You are infection control nurse in charge of the ward. You need to advise the doctors and nurses to prevent transmission of Mrsa while caring for the patient, which is a false statement. A. Share the dressing trolley with other patients without decontamination. B. Wash hands before and after entering the room. C. Use dedicated thermometer for Puan Kamala. D. Take her medical records for contact precaution. Can I have any answer? Can the audience raise your hand and answer this question for me?
Mia.
Okay.
A.
So what is the answer?
A.
Oh, true. Good. Okay. Bagus. Faham.
Mana boleh share
Okay,
trolley?
we go the second question. Okay, second question. Okay, nurses are going to do dressing on Kamala's foot ulcer to prevent transmission of Mrsa. Wash hands before entering and leaving room. Put on glove and gown at the door. Use patient dedicated disposable dressing set. D, all the above. The answer.
All the above.
All the above. Okay, good. Okay, next question. Discussion 2. Mr. Allen, 35 years old teacher in a secondary school. He presented with fever, running nose and myalgia. 10 of his students in school had been having the similar symptoms. He has bronchial asthma and came to emergency department for nebulization. He was admitted to an isolation room. Specimen was taken to investigate for influenza and respiratory viruses. Public health department was alerted in view there was a picture of flu-like cases in the school. You advise Mr. Allen to do the following except A. Cough into his elbow or sleeve, turn his head away from others, wash his hand, wear 3-ply surgical mask only after the result positive for influenza. Which one accept? The answer?
B.
D?
B.
B or D? Accept. Kecuali. You have to advise Mr. Alan to do the following accept.
D.
D. Okay.
Tahun.
We must ask patient to wear 3-ply surgical mask from the beginning. He entered the ED or enter the ward, enter the treatment room. Not only after the result positive for influenza, isn't it? Because you want to protect yourself and also the environment, patient from the influenza, isn't it? Okay.
Betul.
Okay. And Mr. Alan's result, nasopharyngeal swab, influenza A, PCR was detected. He was started on antiviral therapy along with treatment for bronchial asthma. You are the doctor in charge of this patient. You advise nurses who are taking care of Mr. Allen to do the following except wash hand before entering the patient, wear surgical mask when entering the patient's room, take oseltamivir prophylaxis for influenza, wear a filter N95 mask for aerosol generating procedure, for example, nebulization. Accept. What answer? A, B, C, D. C. The answer is C. No need to take prophylaxis for influenza. Okay. The final topic is I will go through a little bit about needle stick injury or sharp injury. Okay, why we must take note about the needle stick injury while we handle the patient, because it can cause risk of getting infectious disease about HIV, Hep C, and Hep B. Okay, and also you have always be alert and cautious when you handle sharps. You must handle all sharp with care and never recap your needles. Okay. Do always wear proper fitting gloves. Don't use loose fitting glove because it's clumsy and also can cause you get a needle stick injury. Can you see the picture? Okay. It's loose. So you must find a well-fit glove for yourself. Do always use a stand when transferring blood. And do not hold the blood container in your hand while transferring blood sample. You can see from the picture, the doctors not wear gloves and also hold the container in her hand. This can cause needle stick injury. Don't recapping. Recapping is not allowed. Discard the used needle properly into the sharps disposable bin, not in the domestic bin. Always use the sharp disposal bin until 2/3 full only. After that, you have to ask the pantai manifest to change the new bin. Do not dispose sharps into general waste bin like this. This is a general waste bin, not a sharp disposable bin. All healthcare workers are advised to wear fully covered shoes. Do not allow cuts, wounds, or even eczema to be left exposed, especially when conducting procedures. All wounds or cut must be covered when you handle the patient. Okay, ini tindakan anda sekadar tutup jarum. Ini bawa OSH sebenarnya. Untuk needle stick injury, dulu UKI pegang kejap and then after that kita give over to OSH lah. Kalau you kena tertutup jarum, you kena dapatkan rawatan kesalahan, you kena bersihkan yang tertutup jarum tu, bawa air mengalir, guna sabun. And then maklumkan kepada ketua jururawat ataupun ketua unit, ketahui punca, and then ambil darah dari punca dan healthcare worker, lapor kepada OSHA and ada rujukan ke FOPC. Okay, cough ethic, we must cover your cough lah, so that you do not spread your disease to other patient. Okay, especially now there's a lot of case influenza, and also even COVID already fasa endemic. We have to stay practice infection control prevention. So that we can protect ourselves and also our patient and also our family. This is the third edition of policies and procedure on infection prevention control. Saya pasti semua department ada salinan and boleh merujuk pada ni lah untuk sebarang polisi dan prosedur tentang IPC. Terima kasih. Infection prevention control is everybody business. It's not just IPC nurse or doctor business. Okay, thank you.